Welcome to Navajo County Connection. I am your guest host, Jeff Lee, filling in for our County Board of Supervisors this month. I am the Chief Health Officer for the Navajo County Health Department, and today our guests are...
I'm Alison Hepner with Navajo County. I'm the Community Outreach Specialist.
I'm Jenelle Lynn. I'm the Nursing Supervisor for the County Health Department.
And we're here today to talk about the Community Health Assessment and the Community Health Improvement Plan. This has been a project, a collaboration with our local public health partners. It includes our hospitals, clinics, schools, law enforcement, fire EMS, elected officials, community groups, and residents. And that's just to name a few of the people that were involved in this. The Community Health Assessment is an assessment that identifies the key health needs and issues, as well as the current health status, through systematic, comprehensive data collection and analysis. With that analysis, we build a community health improvement plan. This is a 5-year systematic effort to address those key public health issues and concerns that were identified in the assessment. One of the things this really helps us with is justifying how funding is used through the health department, how resources should be allocated, and really how to best meet the community needs, and as well as support some grant applications and opportunities we may have. So I'd like to turn it over to Alison and Jenelle to go through the health assessment and the strategic priorities for the next 5 years.
So this started in January, the 10th of January to be exact, and what we did is we brought together, organized a bunch of agencies, organizations, and community members to come together and guide us in the direction we wanted to go in our community health assessments. We came together, came up with a vision, moved on to some assessments where we assessed the community through a survey called the Community Health Assessment Survey. We also did a focus group we did one in Winslow and one in Snowflake. And then after those were completed, we were able to identify issues through collecting data from our community partners specific to our community's needs. With that data, we were able to develop goals and strategies. And right now we're into the action phase of that, where we are moving the strategies forward. So when you focus on healthcare, there's a lot of things that happen in healthcare, and one of that enhance or cause healthcare to be a little bit of an issue, and that's social determinants of health. And what that means is schools, libraries, land, having a house, being able to have a job, all of that can affect a person's health and the quality of life. And so that's what we mean when we talk about social determinants of health, which was a focus of our community health status assessment, addressing those issues. The public health system is a very large system, and when you say public health system, I don't want anybody to think that, oh, this is a hospital, or this is public health, or this is a doctor's office. The public health system actually includes police departments, churches, community centers. We gave a talk at the Heber Community Center, and we talked about how they were promoting diabetes. That's a great thing for community members to do. Elected officials are part of that. Tribal health communities, it's all together in the public health system. So what we ended up doing next is after the community health status assessment was done, we had a bunch of data, community input from focus groups, surveys, and 190 data tables. And that allowed us to identify the priorities that we were going to focus on in our communities, and we put that into the CHIP, which is the Community Health Improvement Plan, which are the goals and objectives for the next 3 to 5 years. So let's talk about what is the high points of Navajo County, because we have a lot, and one of that is air quality. We have great air to breathe. People come up here for the hiking trails, the biking, the city parks, the small town atmosphere that we have. We also, through the surveys, found that we have a lot of knowledge of healthy habits in our community. People knew this. They know about it, but are they doing it is the question. So some factors that we had that weren't the best was we had mental health, substance abuse, poverty, sexually transmitted diseases, and chronic diseases showed in our community health assessment to be priorities that we needed to focus on. So what we did is we took these to our group that we met with at January 10th, and we met again with them on January 19th, and we said prioritize these issues in our community, and they came up with number one being substance abuse. And in Navajo County, we rank against Arizona very high in alcoholic deaths, and that is almost 4 times as high in Navajo County than it is in Arizona. We also are a little higher when it comes to drug deaths and the opioid issues as well. So this became the number one priority that we are looking to address moving forward as a community. And how we are going to address that is we have subcommittees that have come together that include a lot of our agencies and organizations and community members that deal with this or are passionate about this. And we talked about how we would do some awareness campaigns. We're going to do in-school and after-school programs. We're working at partnering with different corporations and organizations in our community to get the information out and to provide help where necessary. The next issue that they said, number 2, was poverty. And poverty is sadly very high in Navajo County. 30% are living in or below poverty, and that 25% have no transportation. They have 24% joblessness, and they have a lower medium income, and a lot are affected with limited child care or elderly care. So what we're doing about that is we've created a coalition who is addressing this through a network of resources. We're mapping all the available resources in the community, and we're working on providing a network so that people can access for more services, and we're also looking at a center and developing a center that would bring services to the community as well. So the third is mental health and behavioral health. And as we know, this is a big issue, not just countywide, but US-wide. In Navajo County, we have a very high suicide rate. It's actually twice the rate as the United States. And with our partners, Summit was able to share that they have at least over 9,000 ER visits related to a mental disorder. Mental health provider shortage is very significant in Navajo County. And we're limiting in our counseling that people actually want that treatment and need it. So what we're doing about this is we're working to lower the suicide rates through education. We're working on training information, and we're looking with partnering with corporations and organizations to reach out to their employees, work on wellness policies, especially when it comes towards mental health, try to get rid of that stigma that mental health comes with, and address that as a subcommittee right now. Number 4, chronic disease is where heart disease is the leading cause of death in Navajo County, followed by cancer. Persons with diabetes in Navajo County are double that than the states. So we're working on bringing awareness to that to the community and find ways to conduct wellness seminars, maybe engage in wellness programs and the promotion of that. And that subcommittee is moving forward at changing that. And the next one I'm going to give to Jenelle to discuss.
So sexually transmitted diseases are a large and growing problem across Navajo County, north to south. We have the second highest rates of gonorrhea and chlamydia in the state, and our syphilis rates are skyrocketing as well. So this is our number 1 public health priority as part of our community health assessment. Some of the things we're doing to address that, we're increasing testing. We want more access to testing for sexually transmitted diseases, and we're providing counseling to enhance and promote healthy behaviors. So sexually transmitted infections, they tend to target the young. 1 in 4 Americans between the ages of 14 and 25 across the United States are infected with a sexually transmitted disease. So we realize that we need to come up with strategies that enable, engage, and meet the needs of our youth especially. So some of our priorities and goals for addressing this concern are empowering youth to be well educated and to have comprehensive sexual health. We want to invest in a health system that is youth friendly and provides reproductive and sexually transmitted disease health services, and combating the stigma that's associated with sexually transmitted diseases so that we can address the problem and move forward.
So another thing that we were able to identify through the community health assessment was our priority groups. We do have some vulnerable populations, and they include the 11,000 children living in poverty. 1 in 4 children households have some kind of a disability. Seniors, half of the population that we have have a disability, and chronic disease conditions is 56% in households of in county households. So those are some priority groups that we were focused on. Now, moving forward, the public health district, what we're doing is we're actually going out, and what we're doing today is getting this information out to the community. We're letting them know that the community health status assessment exists, and like our director had said before, is a great way for accessing grants, and it's good information to have. The other thing is with the community health improvement plan, this is the plan for the next 3 to 5 years that we're moving forward in addressing these priorities, and we're educating our community members on that, whether they want to be a part of that or have resources that can help us. Now, if you are interested in being a part of anything that we're doing right now, it's actually very exciting to be able to know what we can do to affect good, healthy outcomes in our communities is very valuable. And so if you'd like to be a part of this, you can join the MAP meeting. That is the Mobilization for Action Planning and Partnership. And what that meeting is it meets every 2 years. It's a bunch of agencies, organizations, and community members that come together and guide us in the direction that we're going in right now. The other thing is if any of these different committees interest you, if you're interested in poverty, in the substance abuse committee, in STIs, or anything like that, we have these subcommittees that you can actually serve on and be a part of. They usually meet monthly. Understand that this can be accessed easily at navajocountyaz.gov. You can promote the information. It's under public health, under community health assessments. You can get the information out to the community. Be aware that CHA and CHIP exists, especially if you're from an agency that's looking for grants, or if you are looking at projects that you're doing and where they can fit with what we're already doing. It's always great to have those numbers. And then share the information in the community. This CHA, what it did was it let us know where we need to put support and what we need to focus on. And again, if you feel the same way and you're passionate about any of the stuff that we're working towards improving, share the information and come be a part of it. You can get a hold of us through public health easily. I'm Alison Hepner again, and you can reach out to me as community outreach, and I can get you in touch with the information if you need it. So it's exciting to have this information. So I know that we've never had a comprehensive, such a comprehensive CHA assessment or a CHIP ever. We've brought some pretty incredible partners together. We have Summit Healthcare that was a partner from the beginning. We have North Country Healthcare, North NPC. We have Change Point, and we have Arizona at Work, Northeastern Arizona. So, and then of course Public Health that has been, and these key players have been able to really come together to access data and help us complete this. So it's been great.
One of the most interesting things about the CHA and CHIP for Navajo County is it's not just the county government CHA and CHIP. This is Summit's CHA and CHIP. This is North Country's CHA and CHIP. So we all have invested time, money into this to make sure that it is a community-wide comprehensive approach to improving the health for our community. I would like to thank you guys for the information, and definitely reach out to the health department. The CHA and the CHIP are both on our website. Feel free to give us a call and get involved in one of the community groups and one of the strategic priorities. And I want to thank you for joining us on Navajo County Connection, and have a great day.